Hello, everyone, and welcome. I'm excited to have you here today. We're going to talk about sacubitril and valsartan, a heart failure medicine that can significantly lower the risks of hospitalizations and death. In this presentation, we'll explore how this medication works, its benefits, and what it means for patient care. Let's get started. Let's start with the objectives of this presentation. Here, we'll explore the key aspects of the medication, including its introduction, composition, and how it works in the body. We'll also look at its uses, potential side effects, and contraindications to ensure a comprehensive understanding. Moving on to the introduction, we'll set the stage by discussing the medication's background and significance. Then, we'll delve into its composition, highlighting the active ingredients and formulation. Next, we'll examine the mechanism of action, how this medication interacts within the body to produce its effects. After that, we'll review its common uses and the conditions it helps to treat. We'll also go through the possible side effects so you're aware of what to monitor. Lastly, we'll cover contraindications, situations where this medication shouldn't be used to ensure safety. Throughout this presentation, our goal is to give you a clear, thorough understanding of this medication's role, benefits, and precautions. Today, I want to introduce you to sacubitril/valsartan, also known by its brand name Entresto. It's a medication classified as an ARNI, which stands for angiotensin receptor neprilysin inhibitor. This is specifically used for heart failure with reduced ejection fraction, or HFrEF. What makes this combination so impactful is that it helps reduce both cardiovascular death and hospitalizations related to heart failure. Now, to break down the term ARNI a bit more, it's a combination of an ARB, or angiotensin receptor blocker, and a neprilysin inhibitor. This dual action is what makes it particularly effective. It was introduced to the market back in 2015 and was developed by Novartis. This medication specifically targets heart failure where the pumping function of the heart is diminished. By doing so, it not only improves patient outcomes, but also decreases the chances of hospitalization and death. So, in the context of our overall discussion on heart failure treatments, sacubitril/valsartan represents a significant advancement, offering a new option that actively reduces the risk of serious events and helps patients live better, longer lives. Today, I want to talk about the composition of this medication. It's made up of two main components, sacubitril and valsartan. These work together to provide the therapeutic effects we're aiming for. You'll find this medication available in 3 different doses. The first one is 50 milligrams, which contains 24 milligrams of sacubitril and 26 milligrams of valsartan. The second dose is 100 milligrams, with 49 milligrams of sacubitril and 51 milligrams of valsartan. And finally, there's the 200 milligram dose, which has 97 milligrams of sacubitril and 103 milligrams of valsartan. Understanding these different doses is important because it allows us to tailor treatment to each patient's needs. This flexibility plays a key role in managing conditions effectively and safely. Overall, the combination of these two components and the dosing options highlight how this medication offers a versatile approach to treatment. Today, I'd like to talk about sacubitril, which is a neprilysin inhibitor. It's specifically used in treating heart failure with reduced ejection fraction. What makes sacubitril interesting is that it works by preventing the breakdown of bradykinin, a natural vasodilator in our body. By doing so, it helps promote vasodilation, meaning the blood vessels widen. This vasodilation is really beneficial because it reduces the workload on the heart, making it easier for the heart to pump blood. So, overall, sacubitril plays a crucial role in managing heart failure by decreasing the stress on the heart through these vasodilatory effects. Let's talk about valsartan, which is part of the angiotensin II receptor antagonists class. What it does is inhibit the binding of angiotensin I to angiotensin II receptors. This is important because it ultimately decreases aldosterone production, which plays a key role in regulating blood pressure. By blocking this pathway, valsartan prevents vasoconstriction, which is the narrowing of blood vessels, particularly in the heart, blood vessels, and kidneys. This vasodilation helps to lower blood pressure and reduce the workload on the heart. Additionally, valsartan blocks the reabsorption of salt and water in the kidneys. This means more salt and water are excreted, which also contributes to lowering blood volume and pressure. Overall, valsartan's mechanism helps to manage hypertension and protect organs from damage caused by high blood pressure. It's a great example of targeting the renin-angiotensin system to achieve these therapeutic effects. Let's talk about the combined action of this treatment. First, it dilates the arteries, which helps to decrease blood pressure. This is crucial because lowering blood pressure reduces the strain on the heart and blood vessels. Next, it decreases muscle hypertrophy, meaning it can help prevent abnormal thickening of the heart muscle, which is often a response to high blood pressure. Additionally, this approach increases the excretion of excess fluid and sodium. By doing so, it helps reduce swelling and shortness of breath, which are common symptoms in conditions like heart failure. This also means it can lessen the need for diuretics, making management simpler for patients. Overall, these combined effects work together to improve cardiovascular health and ease the symptoms associated with high blood pressure and fluid overload. This slide doesn't contain enough information. That's why we're moving to the next slide. Today, I want to highlight the uses of this treatment, specifically for patients with chronic heart failure with reduced ejection fraction. This applies to those classified as NYHA class II, III, or IV. Essentially, these are patients who experience symptoms ranging from slight limitations in activity to severe limitations, even at rest. It's important because this group represents a significant portion of those suffering from heart failure, and tailored therapies can really make a difference in their quality of life. By understanding which patients benefit most, we can optimize treatment strategies and improve outcomes across this spectrum of severity. Let's talk about some of the side effects that can occur with this medication. One of the more serious but rare side effects is angioedema, which is swelling beneath the skin, often around the face and throat, and requires immediate attention. Another common issue is decreased blood pressure, which can cause dizziness or lightheadedness, especially when standing up quickly. Elevated potassium levels, or high potassium, is also a concern because it can affect your heart rhythm. Some people might experience a cough, which can be persistent and bothersome. Dizziness is another side effect that might happen, particularly when starting the medication or increasing the dose. Lastly, it's important to keep an eye on kidney function, as this medication can sometimes worsen it, so regular monitoring is essential. Understanding these potential side effects helps us weigh the benefits of the medication against the risks, and it emphasizes the importance of close follow-up with your healthcare provider. Let's talk about contraindications, which are important to keep in mind before prescribing this medication. First, hypersensitivity to any of the components is a key concern. If a patient has shown allergic reactions in the past, we need to be cautious. Next, a prior history of angioedema caused by an ACE inhibitor or an ARB is another critical contraindication. Angioedema can be a serious and potentially life-threatening condition, so if a patient has experienced it before, this medication could pose significant risks. Remember, understanding these contraindications helps us ensure patient safety and choose the most appropriate treatment options. When considering how to use this combination therapy, it's important to start by stopping ACE inhibitors or ARBs at least 36 hours before initiating the new regimen. This helps prevent potential overlapping effects that could increase risks. Next, you should begin with a dose that matches what the patient was on previously for ACE or ARB therapy, administered twice daily, once in the morning and once in the early evening. This approach ensures a smooth transition and minimizes side effects. After about 1 to 2 weeks, it's crucial to check blood levels of potassium, sodium, and creatinine. These labs give us a good picture of how the patient's kidneys and electrolytes are responding to the new treatment. From there, the plan is to double the dose each month, gradually increasing until reaching the highest tolerated dose, provided no side effects occur. This titration helps optimize the therapeutic effect while keeping safety in focus. However, if any side effects develop, it's important to decrease the dose promptly. Patient safety is always the top priority, and adjusting the dose based on their response can help prevent adverse events. Overall, careful monitoring and gradual dose escalation are key to safely using this combination therapy and achieving the best outcomes for our patients. This slide doesn't contain enough information. That's why we're moving to the next slide. Thank you so much for being here today. Keep learning because that's truly the key to growth and success. No matter where you are in your journey, continuous learning helps you adapt and stay ahead. Remember, learning isn't just a one-time thing, it's a lifelong process. So I encourage you to stay curious, seek out new knowledge, and embrace opportunities to grow. This is how we make the most of our potential and keep moving forward. Thanks again, and keep learning.